for those of you who are new to hearing about Brightwell Behavioral Health, I just wanted to give you all some information about the hospitals. Typically, we would be out in the hospitals introducing ourselves and telling you all about us, but right now, since we're adhering to social distancing, we're not able to do that. So I just wanted to give a little bit of information about the hospital. Brightwell has currently 2 locations. One is in Clarksville, Indiana, down south on the border, and the other is in East Lansing, Michigan. East Lansing and Clarksville both are standalone hospitals. The Clarksville Hospital has 22 beds and the East Lansing Hospital has 23 beds. They are both geriatric specific, so all of our patients are geriatric functioning, and we're not mixing teenage patients with adult detoxing patients with 80-year-old demented patients. So all of our patients function similarly. A couple of things that are unique to our hospital: we can offer on-site assessments. So when we do get a referral for a potential admission, we can either do the assessment remotely from home or wherever the assessors are, hospital, their car sometimes, or we can also go on site wherever the patient is, whether that's at a nursing home, a hospital, their house, or wherever the patient may be. And we can go lay eyes on the patient, assess the patient in person, review all of their medical information on site, and take a little bit of that load off of the family member or the hospital or facility staff as well. All of our hospitals have psychiatrists as well as medical doctors. So at East Lansing Hospital, our psychiatrist is Dr. Timothy Chapman. Our medical doctor is Dr. Enrique Lopez, and they have a psychologist as well, Timothy Hilton. And then at Clarksville, our psychiatrist is Dr. Ishmael, and our medical doctor is Dr. Kapoor. So an average length of stay at both of our hospitals is roughly 10 to 14 days. It does vary on the specific behaviors the patient is having, their specific insurance, as well as what's going on with the patient while they're with us. So our doctors like to bring the patient in, do their med change, and then also follow that through. So that's where those average length of stays come from. And I will also mention that our average length of stays are below the national average for geriatric psych stays, which is around, I believe, 14 days. The referral process for us, we try to make it as easy as possible for everybody. So if the patient's at a facility or home, wherever they are, their loved one can call us. We have a 24-hour hotline where our liaisons are on call all hours of the day because psych doesn't have a preference on time. So they can give us a call. We'll just get the patient's name, insurance, date of birth, and just briefly what's going on with them. And then we have insurance staff that's on 24/7 as well to check that patient's insurance. So our goal is to contact the facility back within 10 minutes and let them know the insurance outcome. And we're checking that insurance so the facility or the loved one isn't stuck with a big unexpected bill after the patient is discharged. Urgency is always our primary focus. So our liaisons as well as our part-time assessors in the evening are always working as quickly as possible to find a safe placement with us for the patient. And then another thing that is unique to us is our social workers can help with finding alternate placement. So if the patient isn't appropriate to discharge back to their previous placement, whether that be at home or maybe an assisted living or a hospital or even a long-term care facility, our social workers know what facilities in the area have open beds and have, accept psych patients, accept certain insurances. So they work closely with the liaisons that market those areas to find appropriate placements for the patient. Another thing that we do is we have a referral out handbook. So all of our hospitals have basically a list of all possible places patients could go other than us. So if we get a referral that we can't take due to insurance or due to their age or whatever may be going on with them, we know all of our competitors are out there, what insurances they take, what medical complexities they take, and where they're located. So we will always give that referring contact at least 3 other options to try. So we don't ever want to leave anybody lost and not sure what to do. So that's just a little bit about us. Anything you would like to add, Caitlin?
I think that was really great. I don't really have anything to add, but of course, if anybody has any questions or wants to learn more, you can visit our website or call our 24-hour clinical liaison hotline anytime, and someone will be available to answer any questions and provide resources for you.